Hello, everybody. Thank you so much for joining us on this week's episode of Weekly Dose with Dr. Ude. I have Dr. Mann here with us today, and she is going to be talking about hypertension in pregnancy. And it's going to be great stuff, great information. I get a lot of questions about this, so that was why we picked this topic. So we'll get right into introductions. For those that don't know me, my name is Dr. Ude. I am a board certified family medicine physician. I'm based in Martinsburg, West Virginia. I co-own a primary care practice called Apple Valley Family Medicine. We love taking care of our patients here, and our goal is to have our patients not only feeling good, but looking good. So I'm actually going to turn it over to you, Doc, to introduce yourself, and we're going to get started.
Oh, thank you so much, Dr. Ude. I'm so happy to be here.
Hey.
I'm Dr. Mann, and I am an OBGYN in practice for well over 20 years. And this topic of hypertension in pregnancy was in the past not rare, but not something we see every day. These days, we're seeing it every day, multiple times a day. I don't know what has happened, but in pregnancy, there's, for us, three types of hypertension. What we call chronic, that's those who come in with the diagnosis of high blood pressure before pregnancy. Then there is gestational hypertension that develops during pregnancy, and that is usually after 20 weeks. And then the third type is preeclampsia. That's a new onset of high blood pressure in pregnancy, again, after 20 weeks, but it's accompanied by a lot of protein in the urine and can be very severe with severe range blood pressures. And it can affect certain organ systems like the liver or the kidneys and can come with a bunch of symptoms. But for us, high blood pressure is a little bit different than people who are not pregnant. And for us, high blood pressure is a systolic or that top number of 140 or higher, and a lower number, the diastolic of 90 or higher, either or. And that has to be on two occasions, at least 4 hours apart. So it's a little bit different than hypertension in the general population.
Wow. Okay. Now, how do you diagnose it?
So again, when you come for prenatal care, one of the things that happens every single time you come is that your blood pressure is checked. And this is the reason why it is checked, because we're looking for that. Okay. So, and it's super important because it carries a lot of risks for mother and baby in the pregnancy. So when you come for your prenatal care, we're checking your blood pressure, we're asking for urine. And one of the things we're looking for in the urine is protein. And so that's how we're checking for it.
Absolutely. So, what are the forms of treatment that you have when you find one of your pregnant patients has high blood pressure in pregnancy?
Okay, so one of the things we do is initially we counsel mother on watching her diet, not too much salt intake, getting some exercise. And if people can keep their blood pressure in the non-severe range, we just watch. But if that blood pressure starts to creep up, we definitely treat with medications. We have a limited scope of medications we use because a lot of things affect the second person involved in this, and that's the baby. So in pregnancy, we use beta blockers, typically labetalol, and we use another group of drugs called calcium channel blockers. One thing we definitely don't use in pregnancy, I call them the prills, but the ACE inhibitors, lisinopril, that kind of thing, we don't use those because they can actually hurt the growing baby.
Wow. That is very helpful information. So, what would you want to tell? Any tips and tricks for any moms right now or pregnant patients that are listening in that have been told that they have elevated pressures? Do you have any tips or tricks for them?
Yes, absolutely. Number one, come for regular care. We want to get a good estimate of your due date. between 12 and 16 weeks, you're going to be started on a baby aspirin. Why? Because we know now women with hypertension, 13 to 40% of those women will have preeclampsia. You will develop preeclampsia in the pregnancy. So you'll be started on a baby aspirin. As I said already, your blood pressure will be checked at every visit. Your baby will be watched very closely for growth restriction because mothers with hypertension can have babies that are not growing adequately. So that will be watched very carefully. And that will be between 30, probably 32 weeks or so, maybe a little earlier, 28 weeks. You'll start having ultrasounds to check your baby's growth. You'll start having testing at regular intervals to check on your baby, to check the fluid around the baby, to listen to the baby's heartbeat. And it's a little bit closer surveillance than someone who is pregnant without high blood pressure.
Oh, great, great information. So thank you so much. So the other one I always ask, on the flip side, just to get a little bit of information about you. And that's, why do you do what you do, Doc? So I'll ask you that question. Why do you do what you do?
Oh, well, I just absolutely love taking care of my patients, and I love watching women as they go through pregnancy. Deliveries are just absolutely joyful most of the time. And it's just such a special time to be a part of someone's life as a physician.
That's beautiful. What you do is well needed. So thank you so much.
And
Now
I
the
would,
other, go
oh,
ahead.
go ahead. I actually would like to add one thing. It is
Sure,
so
go for it.
super important after
Yeah.
pregnancy, even before, but after pregnancy, mothers need to not only come for their postnatal appointment, but they need to get back to see you and their
Yeah.
family practitioners because we know that women who have high blood pressure in pregnancy or preeclampsia, they are at risk in the future, not only to
That's true.
develop chronic hypertension, but other problems associated with high blood pressure. So it's so important
That's true.
to get back to your primary care to be
That's very true.
monitored. Yes.
That is very, very true. So this is all great information. Now, for those that are looking to connect with you, look you up, where can they find you?
Okay, so I am on social media. I'm on Instagram at Pips for Moms, PIPS, the number 4 moms, because I am there not only teaching about a lot of topics, including this one, but I also have a very special postpartum ice panty that I
Mm,
showcase on that platform. And I'm also on Facebook at Pips Comfort Care.
that is awesome. Thank you so much, Dr. Mann. So, on the flip side, if you're looking for a quality family medicine physician, check us out at Apple Valley Family Medicine. You can find us online at www.applevalleyfamilymed.com, and you can give us a call, 304 We are open 7 days a week, and we will be able to take care of you. Thank you so much, Dr. Mann, and everybody have a wonderful week. Thanks again.
Thank you.
Bye. Thank
Bye-bye.
you. Bye.